Hello there, and today we're going to be talking about what you might not expect affects your gut health. So today we're going to be talking about how our gut health is actually influenced by some of our hormones and specifically by hormonal birth control. So I hope this will be helpful, and let's dive in. Okay, to start with, we're going to talk a little bit about estrogen, metabolism, and our liver. And so estrogen, as I've mentioned in some of my previous videos, is primarily detoxified through our liver. And so our liver has to change estrogen and make it a little bit more soluble in order for us to get rid of it in our bile. And so in order for us to have a healthy gut, we have to have a healthy liver because the liver is providing bile and it's going to be the factor that helps us have easier to pass or not easier to pass bowel movements. So our gut health is really important to digestive wellness, and it can be affected by some of the things we put in it, like our estrogen levels, like synthetic estrogen levels from hormonal birth control as well, because those are going to increase the liver's rate at which it can secrete those things, possibly affecting bile production and our gut motility because of that. And so some of these are how estrogen, when we have a kind of an estrogen dominant state, which is what hormonal birth control tends to encourage, that can cause slower bile production and gut motility. So those are things that we want to take into account that might be affecting our gut health and we don't realize it. Also, hormonal birth control can affect our gut permeability. Now, I know that might be a big word or phrase, but gut permeability means that the tight junctions between our intestinal cells, so really our intestinal cells are kind of like this, and we have these junctions that hold them tight together, and that keeps food particles that are undigested from just slipping through and into our bloodstream. They have to pass through our cell and go through a filtering system for our body to, one, digest them, make sure that they're small enough for our body's bloodstream to handle, and for them to be in the right form, because whole food particles can go through and that can cause inflammation, it can cause autoimmunity, it can cause allergic reactions. So there's a whole slew of things that our gut permeability helps protect us from, and it is one of the forms of our barrier and immune system. So keeping in mind that encouraging tight junctions is really important, and hormonal birth control can affect that gut permeability. So it can actually make it a little bit more permeable and more susceptible to some of those things being able to pass through. Next, hormonal birth control can also affect our gut health because it can decrease the diversity of gut flora. So when we have a healthy, normal gut in our large intestines and our small intestines have a certain amount of healthy bacteria, yeast, fungi that all help break down our food. But when we reduce the diversity, so that's like if you have a forest and instead of having pine trees and oak trees and maple trees, you just cut out everything and you just have pine trees. Pine trees might be nice, but if those other trees served other purposes, you might have mudslides because those other trees had deeper roots that helped prevent the water from rolling away and the soil going with it. So some of those things happen in our body as well. So not just us affect our digestion, the bugs and things inside of us that help us digest, their diversity and ecology can actually help promote our own health. And when we reduce certain populations, other populations can grow really fast and beyond their kind of capable a level of success. So it's called an overshoot. So when you overshoot as a population, you deplete a lot of resources that you might have, and then you cause some massive die-off in response. So one of the things that can get out of balance in our gut is candida, which is a type of yeast, and that can act kind of like a parasite. So just keep in mind that that can cause further gut permeability if that isn't in balance, and hormonal birth control can affect the proportions of those microflora. And the other thing to consider along with this is that when we decrease the populations of certain bacteria or yeast in our gut, then what also can happen is we might start to have the proportions of those mimic for things that people have as chronic illnesses. So there are studies that are done that have microflora that are, for example, higher in certain levels of people who are obese versus non-obese. And so those could be issues that we now become more susceptible to because our gut flora has changed in a way that is going to possibly promote that. So that's part of why hormonal birth control can, one, affect our gut health and then lead to weight loss resistance. So Dr. Jolene Brighton talks about this a little bit in her book, and she goes through, I can link one of her videos down here as well about the metabolic chapter of her book and how that is affected by hormonal birth control. But that is really something that we might want to consider and think through that's affecting our gut health. If we're having digestive health, what other factors are we having that we might not be considering? So what are some of these downstream effects? I would consider hormonal birth control has also caused things like poor carbohydrate metabolism, and that could be because it's affecting our gut health, but it could be as a result of our gut health mimicking other chronic illnesses and issues that we might have had or suffer with or be predisposed to. And so it could be, one, it's kind of a chicken or the egg. Did hormonal birth control cause gut issues and that causes poor carbohydrate metabolism, or is poor carbohydrate metabolism causing poor gut health from taking hormonal birth control? Either way, that means poor carbohydrate metabolism means we have higher levels of blood sugar, lower levels of insulin, and we're going to be more resistant to properly digesting things and promoting proper blood glucose levels. That can have issues such as acne. We can have insulin resistance. We can start to develop other issues that are more serious than just some of these kind of minor nuances to our life that we might not enjoy, like acne. And so that's something to consider. It could be affecting how we actually are metabolizing the food that we take in. And next, I want to talk about how it's going to affect something a little bit further upstream. So there are studies that have shown that our stomach acid can actually be affected by hormonal birth control. So not only are we not primed to metabolize carbohydrates very well, carbohydrates are a complex molecule that requires being broken down in an acidic environment. If our stomach acid is not acidic enough, then we're going to have trouble digesting things. That can cause issues like acid reflux. That means that we don't have the capacity to digest those larger molecules, so we're not going to be able to metabolize them very properly, and downstream from that, so our stomach can't digest them properly, they're going to be larger molecules that, one, could irritate our gut in and of themselves. So that can cause issues like constipation, diarrhea. Two, that could also influence, if we have gut permeability that's increased, we have even larger molecules that could be able to pass through and cause other immune issues. So just keep all of these things in mind. This is part of how hormonal birth control can really affect our gut health, and how some of these hormones not being in proper levels could be affecting us. So not only hormonal birth control, but afterwards, or if our hormones are out of balance and they're mimicking some of those, this could be potential considerations for restoring gut health and starting there as well, in order to have some of these issues start to resolve. And now last, I want to talk about even another layer that's even further downstream. So our stomach's not working quite properly. That leads to our intestines not quite working properly, our gut flora being affected. And now what comes after that? Then we have our excretory system. And so we can then, as I talked about, we have candida in our intestines. When it's in balance, it's perfectly fine. But when it's out of balance, it can cause other issues than just digestive health issues. We can get yeast infections. And so that is a common issue for women on birth control as well. And it's connected with our gut health. And so not only can we get yeast infection in our intestines from candida yeast, but we can get yeast infections in other areas of our body. That can include things like our mouth. We can get thrush. We can get also vaginal yeast infections as well. And those can require certain types of medications that also could further some of these issues being recurrent. And so we really need to consider how we're going to holistically address this when we're taking this into consideration. How has birth control possibly changed our bodies a little bit, and how are we going to plan to recover? So I'll be talking a little bit about that in some future videos, so stay tuned. If you liked this video and you found it helpful, I'd love if you click to the like button and you helped other women be able to find this and inform themselves of how they can help support their own body. Until next time, be well.